Okay. I don't know if I'm live yet. Let me just make sure I'm live.
It's a must from us.
I don't. All right, guys. So I'm live. It's working well. It's doing what it's supposed to be doing. Um. So this is exam one. We got 3 days of information to go through. So we got Thursday, which was our first Thursday, our September 25th. So I'm just gonna go over that today. Tomorrow I'll go over Monday, September 29th, and Thursday, October 2nd. That was today, so that is kind of the end. We just got 3 days of content to go over. So let's go ahead and open Thursday just to see what chapters we got to go over. All right. So we'll go over the slides here as well. We're gonna go over the slides. We're gonna go over the questions in the book, and we're gonna go to the case study provided for these chapters. The quizzes at the end of these chapters. My intent is to make this as comprehensive as I can for per day. You know, let's just divvy it up day by day, and if we take a deep dive out of all of them, and especially if we can, I can listen to myself later, and you guys can listen to whenever you guys want. Um, and if any of you guys are watching, you guys can always just send me a message on GroupMe, just because I'm not going to respond to the chat if there is a chat on YouTube. Um, so yeah. All right. So looks like we are gonna cover chapters 1, 4, and 5 for this. Okay, let's go ahead and start at chapter 1. And I'm gonna try to make this friendly for people who are listening in as well. So I'm not. I would put a camera up to my book, but I don't think make much of a difference. If you guys are just using this as a study tool, then feel free to open your book and just follow along. Um, all right, so Nursing Today is the title of this book. So we're just going to get some context on what the nursing profession is like. So we're just going to look at nursing as a profession, historical influences. So I know that's going to be important, just knowing those names. Contemporary influences. What are some things affecting nursing today? Some current trends in nursing, just to kind of see where we're headed. Professional registered nurse education. So that will kind of go over just ways people achieve being a nurse, ways people get to the NCLEX, and nursing practice. That's also going to go into the practice itself, but also specializations, people who are, what else is there in the field? And professional nursing organizations, which is pretty helpful just to know when we're in the field, just get a good feeling of what's out there and what our rights are as a nurse. Always be aware of your rights as a worker. All right. So the objectives of this first chapter is to explain how standards of practice affect nursing care. Um, Discuss how social factors affect the development of professional roles and responsibilities in nursing practice. Discuss the roles and career opportunities for nurses. Discuss the influences like social, history, political, economic changes, and how this affects nursing, how this will affect us. Discuss how advances in nursing science and evidence-based practice improve patient care. So that's just seeing what works and implementing it. It's a simple idea, but it's an important idea to put into words and to think out and to flesh out in our minds. We also have discussed the educational programs available for professional nurses to become registered nurses, and explain how professional nursing organizations affect both the profession and nursing standards of care. All right. So nursing as a profession, nursing is dynamic and constantly changing as a result of economic factors, healthcare system changes, and public health emergencies. And I'm just gonna be kind of going over the gist of it, just because that's what we're gonna need. This is all pretty theoretical stuff and just conceptual at the beginning, so there's not a lot of stuff I can really dive into as much as we did in A&P for those who watched before, where there's not that this isn't real, but a lot of this can be reasoned without prior knowledge. So nursing as a profession is not a collection of specific skills, and you are not a person trained to perform a specific task. No one factor absolutely differentiates a job from a profession. This kind of is talking about how nursing is an art and a science, and the ways that it's an art is that it's involving using our science-based message and implementing care, compassion, caring, and respect for our patients, uh, and how to respond to families, how to react to certain situations in a professional and uplifting manner. All right, and there's a variety of career opportunities available in nursing, like clinical practice, of course, education. So, our teachers, research. So that would be like the evidence-based practice that we were talking about, management and administration, and even entrepreneurship. And it's important to understand the scope of this professional nursing practice, just because it's all of us are going to be nurses, so we're all going to be going into different things. I mean, hopefully, at least, spread out into the field. So because nursing is both a science and an art, nursing practice requires a blend of current knowledge and practice standards with an insightful and compassionate approach to research your patient's health and care needs. Scope and standard of practice. So that's kind of like the that's kind of like the intro. Oh, and we are also frequently told about Benner, Benner, Benner's levels of nurses. First, we have the novice, so it's like a beginning nursing student. Advanced beginner, a nurse who has some level of experience. Competent, a nurse who has been working for like 2 or 3 years. Proficient, more than a couple years. And expert is the top. So we got scope and standards of practice. When providing nursing care, follow the professional standards of use like code of ethics. These are just some definitions for nursing. Again, it's pretty, you can just figure out with reason. I don't think there's going to be anything we really need to hold on to too bad in this first chapter. 4 and 5 is kind of when we get into some more graphs and things that we've been already questioned on. All right, so code of ethics is just what's right and wrong. Standards of professional performance. There's the ANA standards, which kind of make sure that everyone is doing, uh, sets like a quality, sets a level of quality, and also make sure that nurses aren't doing what they're not supposed to do, and that they are doing what they are supposed to do. So that just kind of comes with any job. So Oh, and the standards of nursing practice is something we come back to a lot, so it's good to just go over it again. Our first step of the in box 1.2, we got assessment. A registered nurse collects patient data and diagnosis. The nurse analyzes and assesses the data. Outcome identification. The registered nurse identifies expected outcomes for a plan individualized to the healthcare consumer. Planning, develop a plan to incorporate some sort of intervention, and implementation, another word for intervention. A registered nurse implements the plan, and then evaluation. So as Professor Sky mentioned today, there's kind of a lot of ways that people, everyone has a different way of wording it, but it's all pretty similar in regards to assess, diagnose, plan, intervene, and then evaluate. All right. Next page. So, as nurses, we will be advocators. We go over this a lot in class. Advocate for your patient's wants, safety, their legal rights, their interests. Caregiver, of course, we're going to maintain their health, our client's health. Educator, you will always be teaching your clients, making sure they understand what medicines are so that they're more inclined to take them, why we're doing certain things so they feel comfortable. It's a and communicator, you got to be just communicating, letting them know what's going on in a way that they understand, which is a pretty important topic, not just in science, not just in nursing, but overall in science. It's like it's pretty cool to think about when you look at all these graphs and stuff when you go to like you know places with science. All these graphs and people like to talk to you. All these scientists like to talk to you about things in their language, and which I always thought was kind of weird. Wouldn't you want to speak to me in a way that I understand what you're talking about? I feel like it's a neglected piece of science, and so just thinking about stuff like that, we got to be a communicator. We got to be a manager for our client as well, like a case manager, just making sure coordinating everyone's effort on a medical team. Um, So, and the nurse clinician, some of just professions. Most nurses provide direct hands on patient care in acute care settings. However, as changes in healthcare services and reimbursement continue, there has been an increase in direct care activities provided in the home care setting and an increased need for community based health promotion. Um, so, just some positions. There's the advanced practice registered nurse, APRN, is most indefinite independently functioning nurse, often being a primary care provider at the forefront of providing preventive care services. And so here we just have some extra career paths, things that people can do, like a clinical nurse specialist. I'm not too concerned about knowing all this stuff. Nurse practitioner, nurse educator, a certified midwife. These are just different career plans. And for those who have medical experience, these are going to be pretty easy to identify in whatever questions we get. All right, so this is where the meat and potatoes is for chapter one. This is where we're gonna, talk about some names. So Florence Nightingale, of course, the first, the big first person. She established the first nursing philosophy based on health maintenance and restoration. She also, we'll talk about it later, was really concerned with the environment, making sure everything was clean, no noise, that there was sunlight, air flowing in. It's kind of touching on some stuff we'll talk about later in some future chapters. So the Civil War also stimulated the growth of nursing in the United States. So Clara Barton, the founder of the American Red Cross, cared for soldiers in battlefields, cleansing their wounds and meeting their basic needs and comforting them at the end of life. So Clara Barton, Red Cross. Um, and this is, I think, the extent we're going to need to know. Just who was this person? What's their name? What's their gist? Dorothy Lynn Dix and Mary Ann Ball. Harriet Tubman also influenced nursing during the Civil War. The first professionally educated African American nurse was Mary Mahoney, Mahoney, who was concerned with the relationships between cultures and race, which we're going to get into later. We'll get into that tomorrow, it seems. Looks like we don't actually touch on that quite yet. Um, I'm just reading right now. Oh, we also touched on magnet programs in class. There's so much knowledge here. There's so much to read. I could read this all, and it would take me all day. All these chapters, like if I were to read them out loud, it would take me all day. So I'm just gonna mostly go over what I think is quizzable material, just stuff that's not reasonable. I'm just repeating that in case you guys are wondering why I'm skimming so much of this. 21st century. Um, all right, and so it looks like we got next a big area dedicated to contemporary influences. So these are just external forces that affect nursing and include the needs of nurses, their self care, and rising costs, demographic changes in the population, human rights, and the increasing number of the medically underserved. So these are again, it's good to say out loud. It's good to flesh out the idea, but it's pretty intuitive. So the importance of nursing self-care, we talk about it all the time. This idea of compassion fatigue, and many people in the field, for those who are already in medical settings, talk about PTSD and how that affects caregivers and how certain smells and things can trigger them. So it's important to take care of yourself. There's a lot of, like Professor Sky says all the time, you're just kind of surrounded by illness and sad feelings, and for a lot of people, it's it's the hardest point, it's the scariest point of their life. So, from a podcast that I was listening to, they kind of talked about how the idea of you can't pour from an empty cup, and Professor Sky also keeps on hammering the idea that who's more important, you or the patient? You are more important. Otherwise, you're not gonna give appropriate care, and you will yourself become a patient. You guys gotta take care of yourselves, and I hope you guys do during this class. Oh yeah, so I'm reading here: compassion fatigue, secondary traumatic stress, trauma that healthcare providers experience when witnessing and caring for others suffering trauma. Yeah, burnout, of course. Um, all right, so again, for contemporary influences that are affecting nursing, healthcare reform and costs. Uh, it's a big problem. The idea of pay for quality, pay for value. Um, Remember that what Professor Sky showed us, that Americans pay the most, but we also receive not the best quality of healthcare. And skyrocketing healthcare costs present challenges to professionals. As a nurse, you're responsible for providing patients with the best quality in an efficient and economically sound manner. And so Professor Sky talked about ways that if patients can't afford a sort of treatment, what can we do to circumnavigate that? What can we do to fill in that procedure or that care? The medically underserved, nursing has a strong history of providing and advocating for healthcare services for the medically underserved. Homelessness, people with mental illness, people with low paying jobs, people who don't have health insurance, people who are unemployed. These people are not going to receive the same care. These people are at a deficit. All right, let's look at some trends in nursing. We got evidence based practice, the idea of just using uh, just using you know assessing problems and coming up with solutions not based off of just assumptions, but of information and studies and meta analysis. Remember, guys, she wants. I think that's a quizzable question. The hierarchy of information. Oh, we're gonna actually go chapter 5 is evidence-based practice. Okay. So genomics again. This is a new thing. Just genes and how we can unlock. How we can use genes to unlock some more information about our patient. Public perception of nursing is pretty good. Everyone likes nurses. That's good for me. Emerging technologies, AI, you know. So pre-licensure. Currently in the United States, the most frequent way to become registered nurse is through the completion of either an associate's or bachelor's degree program. Continuing in service education, doctoral preparation, the nursing practice. The Nurse Practice Act protects the public health and includes, just kind of says what we can and can't do. Licensure certification is passing the NCLEX, which is a computerized adaptive test that will change according to our answers. And after passing the NCLEX, a nurse may choose to work towards certification in a specific area in nursing. Minimum practice or educational requirements are set based on specific certifications. So that makes sense. Things that are more complex. All right. Professional organizations. There are many organizations within hospitals, statewide, national ones, National Student Nurses Association, for example, the Canadian Nursing Students Association, stuff like that. Just be aware. I don't think this is really too relevant. All right, so let's look at the key points. Standards of practice provide the guidelines for implementing and evaluating nursing care. Makes sense. Changes in society, such as healthcare reform, expand nursing roles, changing demographic patterns, increases in the medically unserved population. There are multiple professional career paths, socioeconomic and political factors influence healthcare system, of course. Evidence-based knowledge is critical element of scientific knowledge. There are many types of nursing programs. Professional organizations seek to improve standards. That's about it. This one is pretty intuitive. All right, so let's take some questions. Let's look at some stuff here. I'm going to go on Elsevier here. Hope you guys can see my thing. Here, I'll check. Yeah, you guys can see my thing. Okay. Here we are. Let me check how many viewers. I got 3 viewers. Who is Doctor Who? I don't know if I'm live later. Let me check how many viewers. That's cool. I got a viewer, guys. Someone is watching. I always feel like somebody's watching me. All right, I got the case study here open. Oh, I gotta check out my downloads. All right, cool. I'll have that open. We're just going to do the review questions first. All right, so you're preparing a presentation for your classmates regarding the Clinical Care Coordination Conference for a patient with terminal cancer. As a part of the preparation, you have your classmates read the Nurse Code of Ethics. So what was the Nurse Code of Ethics again? What is the ethics thing about? It's about determining what's right and wrong. All right, your instructor asked the class, why is the document important? So why is the Code of Ethics important? Which statement describes this code? Does the code of ethics improve self-health, protect patient confidentiality, ensure identical care for all patients, or define the principles of right and wrong? It is define the principles of right and wrong. A nurse is caring for a patient with end-stage lung disease. The family wants to go home on oxygen and to be comfortable. The family wants the patient to have a new surgical procedure. The patient wants to go home on oxygen and be comfortable. It's kind of telling us he just wants to spend the rest of his life here, like, in comfort. But the family wants the patient to undergo a new surgical procedure. All right, so the nurse explains the risk and benefits of the operation to the family and discusses the patient's wishes with them. So in this case, he's communicating with the patient, he's advocating, and he's also educating. And in this way, the nurse is acting as the patient's advocates. I'm going to say advocates. And that is correct. All of these are kind of correct answers, you know what I mean? Like, these all make sense. But I think specifically in this case, just regarding about how the family wants something different, the patient wants something different, and that the nurse is acting as an advocate. Hey, this patient wants to live the rest of his life comfortably at home. He doesn't want to do this, stuff like that. Obviously not spoken like that. So contemporary nursing requires that nurses have knowledge and skills for a variety of professional roles and responsibilities. Which of the following are examples of these roles and responsibilities? So we already mentioned a caregiver. We mentioned patient advocate. Autonomy. Yeah, so nurses have to have autonomy just in like being independent, being able to use their own clinical judgments. Health promotion, it's primary care. I'm using words from using terms from other weeks. Anyways, but I'm gonna say no on genetic counselor just because that is not in the scope of nurses. Genomics is gonna unlock a lot of stuff for us in the future. It's already being used in really amazing ways, but it's just not here right now. So that's what I'm gonna say. I'm gonna say 1 through 4. Let's see what it is. 1, 2, 3, 4. Okay, perfect. All right, let's go to 4. Match the advanced nursing practice specialty with the statement. So clinical nurse specialist. All right. That lines up with expert clinician. Nurse anesthetics. Anesthesiologists, we probably all know what they are, especially if you have clinical experience. If you don't have clinical experience, you probably know what an anesthesiologist is just because of the money associated with it. Everyone tells you, be a nurse anesthesiologist, they make so much money. So, of course, provide anesthesia. That's going to line up with D. Nurse practitioner. So that's just going to be provides comprehensive care, usually in a primary care setting. So yeah, and a midwife kind of is including pregnancy and gynecology service. A critical care nurse is using A critical care nurse is using new research-based interventions to correctly position students who are on ventilators to reduce pneumonia caused by the accumulation of respiratory secretions. This is an example of evidence-based practice, right? Because the intervention is based off of new research. So that's about it for chapter 1. Let's go ahead and look at the case study. I got the case study with the answers here open. Maylee is a new nurse graduate who is attending orientation at a local hospital. All right, let's just read this. I'm sure we can answer the question. Meili learns about the hospital's protocol regarding bioterrorism. Which of the following are examples of public health simulations exercised that train nurses for threats of bioterrorism? Uh, Here we got vaccine research. Let's go ahead and look up the definition of bioterrorism. Involves intentionally releasing viruses, bacteria, or toxins to harm people, livestock, or crops. Okay, that's what I thought it was, but it just didn't really make sense. Um, so, vaccine research is going to help against bioterrorism. That's why we got answer here. Prioritization. I'm not sure what that would mean. Decontamination, of course, would help against bioterrorism. And triage. What is triage? Preliminary assessments of patients or casualties in order to determine urgency. Oh, yeah, right. Triage is just another form of prioritization, I guess. Okay. The hospital in which Meili is employed is a large county health care facility that cares for thousands of medically underserved patients. Which of the following contribute to increases in medically underserved population? Government funding does not increase the underserved population. Government funding would decrease it. Yeah, I don't know. Government funding in some ways does increase the medically underserved population just because where the funding goes. Um, but that's not what they want. They don't care for it. Mental illness, of course, we already talked about for medically underserved patients are mental illness, homelessness, and again, the low paying jobs for the answer D, rising healthcare costs. Since nursing is a caring profession, Meili does not need to be concerned about budgets and rise costs. No, we have to be concerned. Nurses are responsible for providing the patient with the best quality nursing care in an efficient and economically sound manner by adhering to budgets and helping to decrease the rising healthcare costs. The costs are going up. We can't just, leave our patients for dead. All right. Chapter 1 is done. So I'll go over the slides at the end just because the slides go over 1, 4, and 5. And the slides should be relatively quick. All right, so let's go to 4. Let me go on my downloads. 4. All right, cool. So let's just read over chapter 4 here. Tomorrow we'll go over 2 and 3. All right, chapter 4. How are you guys doing? Is everything doing all good? What the heck? There's people watching right now. My chat is blowing up. Oh my gosh. Shout out to Leslie and shout out to Coral Lemon. What is that? Shout out to Doctor Who. Yes, this case study is from the Elsevier Resources. The Elsevier Resources also has here. You guys can look at my cursor. Has answer keys for the questions at the end. However, it's I remember them, so I'm just gonna tell you guys them. So I'm not gonna worry about that. The case studies is something that is unique to Elsevier. Otherwise, the principal key points are the same key points at the end of every chapter, so don't worry about it. I have a delay on you guys on regards to the on the messages, so I'm a little bit ahead of you guys. just because that's how the streaming works. Yeah, you guys are live. All right, cool. I'm gonna open them all up for you, so you guys don't have to really worry about it. Else, if you guys are gonna watch this, anyways, let's get back to it. All right, so chapter 4, the theoretical foundations of nursing practice. So what are we gonna go over? I'm gonna go ahead and first read the key points, just so I can kind of introduce you guys to the ideas before we get to reading. All right, just so you guys can figure out what's important. What am I trying to get out of this chapter? Nurses use theory to describe and explain and predict to prescribe nursing care. The components of a theory provide a foundation for knowledge for nurses to direct and deliver nursing care. The nursing meta paradigm includes the four concepts of a person: health, environment, situation, and nursing. That doesn't make a lot of sense the way it reads. Theories are dynamic and responsive to the changing environment in which we live. All right, so these theories are they're not concrete; they're adaptive. Types of nursing theories include grand theories, middle range theories, practice theories, descriptive and prescriptive theories. The integration of theory into practice leads to coordinated care delivery. Nurses need a strong scientific knowledge base from nursing and other disciplines such as biomedical, sociological, and behavioral sciences. We got to be able to, are we going to discuss how Sigmund Freud was freaked out? We might discuss it. He has a for his developmental stages. That's actually going to be in the second exam. Everything was related to sex, and I read it, and then I studied it on my own just because I was like, not that I was studying it, but I was just kind of curious. I'm like, what the hell are you talking about? And it's yeah, it's pretty crazy. Yeah, I don't know where he got that. He has a lot of foundational work in psychology, and so I don't know. I guess if he said so, you know what I mean. He know best. All right. Nurses need a strong scientific knowledge. All right. Sorry. Grand middle range nursing theories can help you understand the practice of nursing. Uh, national. I'm not reading that. Builds upon nursing theories and can be used as a guide for critical thinking, clinical judgment, and providing patient care. The relationship between theory and research builds the scientific knowledge base of learning, and which is then applied to practice. Okay, so that's kind of the general ideas we're going to go over. So don't worry about it if you didn't really capture all of that. I just want to front load some of that information. What should I be? What are the words I should be, taking special attention to? And if a lot of those words don't have any meaning to you, just because you don't know what they mean, you don't know the definitions, I'm going to specifically go over those definitions. Uh, Coral, don't talk about that in my chat. We're learning. This is serious. Coral Lemon, at Coral Lemon. Okay. So let's go over some definitions here. What is a theory? What is this? What is the definition of theory that we're going to use? A theory. Okay, what is a theory? A theory helps to explain an event by defining ideas or concepts, explaining relationships among the concepts, and predicting the outcomes. In the case of nursing, theories are designed to explain phenomena such as self care or caring. Um, so it's pretty broad. It's a pretty broad thing. Uh, okay, so that's what a theory is. I don't have a good grasp on it either. I'm like, theory, just an idea, linking concepts, uh, linking concept to predict something. Just think of your own definition of theory, and it's a lot better than this one. This one's just kind of a word salad. Um, Anyways, so a meta theory. So what is this meta theory we were just hearing earlier? A meta theory is an area of study that looks at the relationships of various components that make up knowledge of a discipline. These include philosophical, theoretical, and empirical components that provide a broad overview of a discipline. So a meta theory would be a theory that uses other theories. Um, so a meta theory would be like the theory of nursing, um, because it interacts with the philosophical theories and stuff like that. I think these definitions are done. A nursing theory conceptualizes an aspect of nursing to describe, explain, and predict or prescribe nursing care. Um, and again, this is just some words we're using. I just just think about it as a way of thinking, I guess. The word theory just throws me off. Theories are offer a framework for assessing your patient situations. They also may help you recognize and analyze cues that emerge from data. So people have different theories. People have different values and ideas on what things mean. So that's just kind of what we're going to talk about here in this chapter. So components of a theory. Theories contain concepts, definitions, and assumptions or propositions that explain a phenomenon. Um, and so, right, everyone's going to have a different one. People who will work different parts of the world, they're going to have different assumptions. They're going to have um, different definitions. They're going to and different concepts, different ideas on concepts, and that's what's going to formulate their explanation of a phenomenon. People around the world are going to see the same set of vitals, and they're going to be thinking a different thing. You can change one set of values, and everyone's going to have a general idea of what's going on, but people are going to differ, and that's kind of the idea of what we're getting at for theory. So a phenomenon. What is a phenomenon? Why are they using this word phenomenon? A phenomenon is a term or description or label given to describe an idea or response about an event, a situation, a process, a group of events, or a group of situations. Otherwise, a thing, an event. Come on, guys. Let's get out of these big words. I understand when they're important. I understand when they have function. But phenomenon is just not it, guys. Come on. Let's make education teachable. Concepts. A concept, what is a concept? Is a thought or idea put into words or phrases. Okay, thank you. Concepts can be abstract or can be concrete. All right. So theorists use definitions to communicate general meaning of concepts of a theory. So definitions may be theoretical, conceptual, or operation. Theoretical or conceptual definitions simply define a concept. So a conceptual definition would be defining a concept. Operational definitions state how concepts are measured. Conceptually, a nursing concept conceptually defines pain as a physical discomfort and operationally as a patient reporting. So operationally means we can measure it. Conceptually means things that we can't measure, ideas. This is stupid. This is dumb. Why are you having me read this? All right, assumptions are bad. Assumptions can be good. They can be bad as well. Let's monitor our assumption. A paradigm is a pattern of beliefs used to describe the domain of a discipline. It links the concepts, theories, beliefs, and values and assumptions accepted and applied by a discipline. I don't know what you mean by that. The term conceptual framework is often used synonymously with paradigm. I'm over. I'm going to the next page. I don't know what you're talking about. The meat and potatoes of this chapter is the theories, people's theories. So that's where we're gonna get into. evolution of nursing theory. So again, the first person to do it is Florence Nightingale. She found her belief that nursing could improve a patient's environment to facilitate recovery. So get that kind of in your head about Florence Nightingale. What's her theory? It's environment. She had a um, big focus on environment. All right. Now for some more jargon. What is a grand theory? Grand theories are abstract, broad in scope, and complex. Therefore, they require further clarification through research so they can be applied to nursing practice. A grand theory does not provide guidance for specific nursing interventions. Instead, it provides the structural framework for general global ideas about nursing. Grand theories intend to answer questions like what is nursing? Okay. Middle range theories are more limited in scope and less abstract. They address a specific phenomenon and reflect practice. Okay. Such as uncertainty, social support, quality of life. So it's narrowing down. So here, if you guys can look at this too for figure 4.3. The most abstract is the meta theory, the one that kind of uses multiple different theories. Grand theories are big questions like what is this? What is nursing? Who are we? Middle range theories get into kind of focusing on like social support. Practice theories would be like ways people incorporate social support. So, anyways, do you have to know that really? No, not really. It's pretty intuitive. It's pretty dumb. Descriptive theories are the first level of theory development. They describe the phenomenon and identify certain circumstances. Prescriptive theories address nursing interventions for a phenomenon, guide practice change, and predict the consequences. That makes sense. Leslie says phenomenal. Coral says, can we talk about the steps to make a change, process to make a change? What are the steps? I think we're gonna get into that in I don't think we're gonna get into that today. Coral, we're gonna go over specifically what we covered on Thursday, September 26th. And those steps for change are I think you're talking about pre-contemplation, contemplation, preparation, and action. That's going to be in the other days. I'm just going to go day by day just to make it bite-sized. Also, I recommend everyone else does that too. Not specifically just like, uh, do it day by day. That's my study strategy at least. Um, Next, we have evidence-based practice is what we're going to do next. Um, so yeah, we won't really get into that. The meat and potatoes of today is probably going to be the different nursing theories. So shared theories. Okay. Yes. Okay. So now we're here. Next page. I'm on page 48. Select nursing theories. Nightingale's environmental theory. That's gonna for sure be on the test. She's always talking to me about asking who's who. Orem self care. Um, so Orem self care deficit nursing theory, specifically, again, these are just ways to think. Uh, or specifically ways to think. So Nightingale, has a lot of importance on her environmental theory. Peplau's interpersonal theory is nurses develop therapeutic relationship with patients that are respectful, empathetic, and non-judgmental. So specifically, Peplau is concerned with getting a relationship with the patient, and that's what the most important thing is for her. Orem self care is specifically nursing someone back into health so that they're able to take care of themselves. That's how we measure. That's how Orem likes to measure progress, likes to measure health. Can we get you to take care of yourself? And Leninger's culture care theory talks about how important care is. So just associate the names. For Leninger's culture, associating those two ideas, I think about how it's Leninger looks so foreign, and so I think of culture. Orem self care deficit. Uh, I don't know. His name is kind of weird, so it kind of helps you remember. Peplau's Peplau's I think of kind of pep talk, and Nightingale is just because I when I think about Nightingale and environmental theory, I think about the photos that we see where soldiers are like on beds side by side by side by side, and it's in dark rooms, and how Nightingale made the rooms smaller and more comfortable, and windows open, stuff like that. We got some more theories here, some more nursing theories we can look at. So Johnson is behavioral systems, Newman is systems. Newman views people as open systems with constant energy exchange. King is goal attainment. Uh, Unfortunately, I think a lot of the quiz, like, and she said it. She said that it would be theories, that we would be talking about people. So unfortunately, I think we're gonna have to commit some of these to memory. And so let's just go over that really quick, just so we feel confident. You guys can study this further on your own, but try to get some mnemonics and some ways to remember. So Henderson, I don't remember this one. Nurse's assistant assist patient with 14 activities. Huh. So Abdella is patient-centered care. King is goal attainment. Roy, this is a big one. I think we're gonna need to know Roy. We get talked about Roy all the time. Roy's adaptation. So nurses specifically help patients adapt and cope with physiological changes, their self-identity, their role functions changing. Once people get chronic illnesses and stuff. All right. So Roy adaptation. Uh, I don't have a mnemonic on that one. Watson caring. We've been talking about that in class, so that should be somewhat familiar to you guys. So Watson talks about how caring is fundamental. Benner also talked about how caring was the number one uh, characteristic of a good nurse is care. Um, and I'm just kind of throwing some information out just to kind of glue some of this information to information that we should know. Uh, Rogers, Parse, and Newman. I don't know the hell that shit is. Benner skill acquisition. So the idea of those 5 levels from novice, advanced beginner, competent, proficient, and expert. Kolbaka is comfort. Nurses facilitate seeking behaviors in patients and striving to relieve physical, emotional, environmental distress. Pender is health promotion. American Association of Critical Care Nurses. Synergy. Okay, I don't think we gotta know those at the very bottom. Um, so why should we care about these theories? What do these theories really mean for us? Um, this is kind of like what I should have kind of started with at first. Just like, what are these theories? Why do we gotta know them? And it's that they're basic guidelines. They're questions. They kind of promote questions to ask. They give us an idea of what we should be looking for. Um, just because the way we think is what promotes the type of questions we ask. It's a So yeah, just think about these theories. Like, why are we learning these theories? What is it with this theory stuff? It's we're trying to learn. We're trying to adopt a train of thought so that we can ask questions. All right, so it looks like we made it to the end of nursing and healthcare environment. Oh wait, sorry. Theoretical foundations. Okay, so let's do some questions here, guys. Let's do some questions. This is the fun part. And let's just go over the key points one more time just to make sure we're all on the same page. Nurses use theory to describe and explain and predict uh, and prescribe nursing care. Okay, this makes a lot more sense now that we read the definitions. The components of a theory provide the foundations for knowledge for nurses to direct and deliver nursing care. Right? So these theories are just uh, schools of thought, ways to think, things that provide us things to look for, things to how to interpret. So, nursing meta paradigm includes the 4 concepts of a person: health, environment, situation, and nursing, which allows nurses to understand what nursing is, what nursing does, and why nurses do what they do. So, in words that we can understand, nurse paradigm, like the concepts and ideas, just absorbing these and fleshing them out in our minds is what kind of helps us put ourselves into the context of healthcare. Getting all these ideas in, the conceptual theories, looking at all these things, social factors, physiological factors, emotional factors, cognitive factors. These are what guide us as nurses to do, what to do, how to think. So, these are very conceptual. Some of these are abstract ideas, and a lot of them are intuitive. But we still got to go over it because I'd rather get caught with it than without it. All right. Types of nursing theories include grand theories, middle range theories, practice theories, descriptive and prescriptive theories. So descriptive theories is just identifying a phenomenon. Again, what is phenomenon? Event, a thing, something. Um, and prescriptive is after that we've identified it. What are we going to do to change? Uh, Practice theories are those theories of like ideas and ways to think about IV implants. Middle range theories, if we're using the same idea of IV, a middle range theory would be like administration of drugs. Like I'm gonna think about administration of drugs. It's gonna guide research. It's gonna guide my thinking. It's gonna allow me to consider all these different things and make sense of it all. And grand theories are super abstract ideas like, if we're still using that IV, like what questions like what is nursing, uh, what is care, what is care through administration of drugs. These really open-ended questions. How do drugs help, you know? So again, it's like just know the basic concept, and I think that'll suffice. Nursing needs strong scientific knowledge. Grand middle theories can help you understand. All right, cool. So let's do some review questions here. And then we got one more chapter, and this next chapter is actually pretty short, so looks like we'll be ending it, and we'll all be able to sleep a little bit more comfortably. Um, so yeah, a nurse ensures that each. Here, let me open this and get it ready. All right. A nurse ensures that each patient's room is clean, well ventilated, and free from clutter, excessive noise, and extreme in temperature. Which theory's work is practicing in this example? Is practiced in this example. Number 4, Nightingale, guys. Remember, environments. When you picture Nightingale, remember those photos of the Crimean War, where it's dirty, there's no sunlight, stuff like that. Um, what are the other answers here? We got Henderson. What was Henderson? Oh, what was Henderson? Let's try to do some active recall here. I'm gonna skip on that. Orem was self-care deficit, trying to help someone. What is the goal of my care? The goal of my care is so that someone can take care of themselves. That's what I'm measuring. Peplau. What was our mnemonic for Peplau? Pep talk. Peplau is more like the interpersonal relationship with your patient. King. What was King? Goal attainment. Uh, so let's look back at Henderson. Henderson was nurse assists in patients with 14 activities. It's pretty weird. No, it's pretty broad. It's just principles and practice of nursing, like helping them breathe, eat, poop, move, sleep. Hmm. But yeah, that's what I mean. I think we're gonna be asked and quizzed on what these theories are. So after this, I'm probably just gonna brush up on them a little more. Uh, okay, just a little more information on Orem's self-care thing. He believes that if patients are able to take care of themselves, that it's better. It's better than the nurse doing it. They will heal better. That's what Orem thinks. Okay, so a nurse is caring for a patient admitted to a neurological unit, and his diagnosis was a stroke and the right side weaknesses. Nurse assumes responsibility for bathing and feeding the patient until the patient can begin performing these activities. We just brushed up on it. Orem, guys. So yes, that's correct. So what was Johnson again? The other answers here. Number 1 is Johnson. Gosh, I forgot. Behavioral systems. Okay, let's just brush up on that. Nurses perceive patients as being more important than their disease. Okay, so Johnson kind of believes in the goal is to help a patient maintain balance, function, and stability of each subsystem. And these subsystems are basic drives like wanting achievement, wanting to be affiliated with people, aggression, dependence, elimination, sex, restoration. So it's kind of like Johnson is kind of focused on behavior as a measure of health, which is interesting. All right. So, which of the following statements related to theory? Oh, yeah, we read it. Yeah, it was Orm. Which of the following? Oh, we haven't done the rest. Roy. Who's Roy? What is his ideas? Roy is adaptation, guys. Um, Peplau, pep talk, interpersonal connections, nurse and patient. All right, Benner. What is Benner? Benner is the nurses growing and developing with those 5 skills. Novice, advanced beginner. You guys, what is the rest? Advanced beginner, competent, and expert. I'm missing one, but yeah. Advanced beginner, competence. Proficient. That's the one I was. All right. Which of the following statements related to theory-based nursing in theory-based nursing practice are correct? Okay, so we're doing theory-based. We're adopting ideas, adopting methods of thinking. So nursing theories differentiate nursing from other disciplines. I would say that's correct. Um, just because like it's just another thing that helps. Of course, nursing is already different from other disciplines, but it's the theory, it's the way we take this job, it's the way we think is what helps differentiate, you know. Compared to a CNA, it's completely different responsibilities, it's completely different levels of thinking and prioritization. All right, so nursing theories are standard and do not change over time. This is incorrect. Things are changing, but they're still relevant. So that was not correct. Integrating theory into practice promotes coordinated care delivery. I would say that's true. Okay, let's see if it's true. It is true. Which makes sense just because once these theories that we're reading, like Orem self care or Nightingale, it's like it's trying to achieve certain effects, and of course, if you're gonna try to achieve big effects like goal attainment for King, it's gonna require coordinated care. It's gonna coordinate everyone in the care system and on the care team for a patient to get in on these goals. Or, for example, for Nightingale, it's going to coordinate the team to keep the environment clean. All right, so nursing knowledge is generated by theory. I'm going to say yes. All right. Yeah, this says that it's true. And it kind of sounds kind of weird. Nursing knowledge is generated by theory. These abstract ideas, they generate our knowledge. Um, and this would be the case just because, again, theory is what guides our thinking. These ideas, these priorities, these concepts that we subscribe to is what's going to drive our thinking. It's where we're going to direct our eyes. And where we're going to direct our eyes is where we're going to learn. So that's how theory would generate nursing knowledge. Theory is the lens, the glasses we're looking through to see the world. All right, the theory of nursing practice is used in patient care, is in planning patient care. This one I thought was a little dumb. That one is incorrect, and I don't really. It's just such a word salad that I don't even want to hear the justification. Okay, and the last one: evidence-based practice results from theory testing research. Right. So theory testing research is, whereas we got a theory, we're subscribing to a certain idea, we're gonna test some questions from this theory. This method of thinking. I don't like this. I don't like the word salad. I don't like how they do that. All right, using Maslow's hierarchy of needs to identify using Maslow's hierarchy of needs, identify the priority for a patient who is expecting chest pain and difficulty breathing. So self-actualization is the first possible answer. That one's at the very top. 2 is the basic needs like air, water, and nutrition. Number 3 is safety, esteem, and self needs. All right, so to answer this question, I'm just going to outline hierarchy of needs again, just so you guys can get a quick reminder on it. So hierarchy of needs, we're going to go air, water, nutrition first. You got to be able to sustain yourself. Shelter. Okay, so the next level of the pyramid. Here we got our basics. Food, water, stuff like that. Next is safety and security. Okay. You got to be safe, overall, just safety and being able, that kind of makes sense why it's the base of the pyramid. All right. Hold on, I'm receiving a call. Hello? What's up? Okay. I'm wrapping up my thing right now. I'm wrapping up my stream, my big stream. Okay, cool. Okay, bye. I love you. Sorry about that, guys. Okay, so sorry, where was I? Okay, so we're at the pyramid. Bottom is food, water. Top is safety. Next is esteem, self-esteem, and then at the very top is self-actualization. Kind of like enlightenment. You know what I mean? So if someone's experiencing chest pains and difficulty breathing, obviously their number one concern is getting air. I need air. So that's going to be the answer for that. When providing discharge care to a new mother, which of the following interventions consistent with Malaise transition theory can result in healthy transition? Malaise transition theory. What are you talking about? I don't remember reading that. Oh, it's one of the very bottom ones that I said we didn't really need to know. All right, so Malaise, Sawyer, and Messias and Shoemaker is transitions. Patients are more vulnerable during changes in health illnesses. Nurses can facilitate healthy transitions through the development of nursing interventions for a specific patient. For example, a patient's transition from a living home to nursing home can cause declining health. That makes a lot of sense. I like that. I like that theory. Okay, so that's Malaise. I will think of Malaise. I would think of Malaysia. I would think Malaysia is transitioning. I don't know. Maybe how Tom Sawyer for Sawyer, how he transitioned from area and then he was not racist anymore. If you guys haven't read that book, I like that book. Tom Sawyer's Adventures. It's a children's book. Okay, so Malay is transition theory. People are vulnerable in transitions. Let's answer this question. Which of the following interventions consistent with Malay's transition theory that can result in a healthy transition? Providing education. That's going to be true regardless, so I'm going to say so. Identifying available support. I'm going to say that's true as well, of course. Discussing the expensive childcare. I wouldn't do that. And allowing the expression of concerns and emotions, of course. Providing information about support group for new patients. Okay. So all of them are correct except the discussing expensive childcare. I don't even think you got to be familiar with that theory to know. Don't tell a mother, oh man, it's going to cost you $20,000. You know what I mean? All right, so evidence-based practice. I'm going to get up, stand here for a second. I'm going to eat a fig from Oceana. Shout out to Darby. She let me eat one of her figs from lunch. Alright. Breakdown. All right, so now we're at evidence-based practice. I'm going to go ahead and read the key points here. This is our final chapter of the day. Again, I'm reading the key points just so we can figure out what to listen for, keep an eye out, keep an ear out for. What are we trying to get at here? Just because there's so much information. All right, so key points. Healthy people or an organization identifies leading health indicators that are high priority health issues in the United States. Definitions of health are complex and vary amongst individuals. Individuals based on health beliefs, developmental age. Oh, shoot, I'm on the wrong one. I'm like, what? This sounds like... Sorry. Just because this chapter is so small, I skipped ahead too much. So now you guys get to meet my girlfriend. So this is going to be Savannah. I'll just orient myself here so I can get to it. Hello, Savannah.
Hi.
We're just reading a little bit.
Hi, guys.
This is on the Real as Bad as Films too. Hi, subscribers.
Hi, subscribers. Welcome to another episode of Bus or Bus.
Okay, anyways. For key points so this chapter is about evidence-based practice. Evidence-based practice guides nurses in addressing clinical problems by looking for the very best scientific and clinical evidence available. So we're going to get into that, ranking information, seeing what is good, what is bad, and treating and managing problems and implementing these changes in practice. So we're going to also see the methods that people use. And what I mean by that, basically like the steps, evaluating and then implementing a change and then comparing and then evaluating the overall results. All right. So evidence-based practice helps you critically appraise scientific evidence. We'll get into that. Steps of evidence-based practice includes cultivating a spirit of inquiry. Of course, before you start researching, you got to develop a want to know why. So that's what the developing a spirit of inquiry is, which I think is really interesting because developing the spirit of inquiry, Professor Sky mentioned how it's not just about yourself, not just developing a spirit of inquiry yourself, but developing it amongst a group and developing amongst your units and trying to get some change happening, which I thought was really cool. How, I don't know, I just like the idea. Just because the cultivate spirit of inquiry just sounds kind of weird, kind of word salad. All right, asking the clinical questions in a PCOT format. All right, so you guys don't know PCOT. It's going to be population. When we're going to ask a question, when we're going to want evidence-based practice, we got to first ask a PCOT question. Just so we can measure, just so it's empirical and just so it's we can get some results and that we can look at and be confident in. So PCOT, population. The intervention, what are we doing different? What are we changing? What are we hoping helps? Comparison, comparing it to no change. Think about dependent and independent variables, something like that, The O is, what is the O? I don't know, we'll get into it. T is for time. Oh, outcome. Yes, right. Okay. Systematic review analysis. Meta-analysis are the best. We'll get into that. Nurses apply evidence in practice through direct application of evidence, right? Research process is an orderly sixth step that allows you to quantitative research includes experimental, non-experimental survey, and evaluation research. These methods are similar in that they're systematic, objective methodologies that use numerical data. Qualitative research So quantitative versus qualitative. So qualitative research would be like everyone seemed to set after I did this, and quantitative research would be like more people spent um, more time in the bathroom after I did this change. Something you can quantitative, think about quantity, measuring numbers, and qualitative, think about like things that can't really be measured in much, but definitely have real effects and consequences, and things that we can react to. Nursing research is a systematic process that asks the answers in questions to generate new knowledge, right? So we kind of talked about that before with theory. And transitional research in nursing is conducted to promote. I didn't even do the chapter 4 case study. Okay, we'll do that right after this. Um, okay, yeah. So Jennifer, as at a first semester, Jennifer knows that blank blank describes phenomenon, speculate on why they occur. I'm gonna say theory. I don't know what this first word is here. Okay, it looks like it's gonna be descriptive theories. Oh, I should have guessed from describe. Descriptive theories. Okay. And prescriptive would be like using again, just so we can get some more more action with using these weird words. Prescriptive theory would be like using your assessment after post assessment, implementing some of it, making a change. Jennifer learns about a focus of nursing theories. Nursing theories focus on the phenomenon of nursing and nursing care. Again, phenomenon is just the vocabulary, the words that they like to use for this sort of language. I don't like it, but we just have to get used to it. All right, so Jennifer learns that the difference between internal and external patient factors. Which of the following is an example of an external that affects the patient? Change in healthcare policy. That is super external. Doesn't have to do really much with anything about the patient. Increases in health premium. That is very external. Changes in cognitive function, of course, internal, and respiratory rate, of course, internal. Okay, cool. Let's go to the fifth one, and then it should be good. Yeah, okay, cool. We got one lone viewer in here. We're gonna get through. I'm not getting off until I finish this, so let's get it. Let's get it, you lone viewer. All right, the need for evidence-based practice. Okay, so there's a need, of course. Nurses regularly face important clinical decisions when caring for patients. Um, Again, this is very intuitive. We know that we should be doing this. Okay, so what are the steps of evidence-based practice? So number one, or zero counted into the book, is cultivate a spirit of inquiry within yourself or in your environment, in your units, in your class. And then the first step is to ask the PICO question: population, intervention, comparison, outcome, and time. Systematically search and collect for most relevant information. So, it actually kind of goes over each step here, so I won't really go into it just yet. Integrate the best evidence with your clinical expertise and patients with family preferences that value the best practice. Evaluate the outcomes, decisions, change evidence. All right, so in non-jargon words. Number one, have some curiosity, have some want to change, have some, and cultivate a spirit of inquiry. Okay, now we're gonna ask a PICO style question. Makes sense. Once we have that question, it's gonna guide us to find research, and we're gonna try to find the best research. And so we're gonna get into that. What is the best research? And then once we have the research, once you find it, we're going to critically appraise it. We're going to see if it's relevant to us. We're going to see if it's a good study. If it's quantitative or qualitative, we're going to take all of this into account. And then we're going to integrate some of it. We're going to implement a sort of change. And then after that, we're going to evaluate, see if it worked, see if it didn't work. And then once we're all done with that, we're going to communicate. We're going to tell the rest of our unit, hey, we're going to do it this way. Hey, hospital, I think we should do it. I think you should make a, not just in my floor and in my unit, make a change. You should make a change to the rest of the hospital. All right, so let's skip all this. All right, so for when you search and collect for the best evidence, I think this is the meat potatoes of this chapter. You're just going to want to go to peer-reviewed articles. You're also going to want to go meta-analysis. So here we got this triangle here you can kind of see if you're following along on page 59. The number one best source of information is systemic meta-analysis. So what are meta-analysis? Kind of like meta-theories. They incorporate many studies. Meta-analysis would be like if I looked up on a search engine a bunch of studies about red meat and cancer. I scraped the internet for all of them I could find and then made a general consensus, and that was my research paper, was gathering everyone's information and then kind of evaluating it. So meta-analysis are the best because not only are they peer-reviewed and empirical, they use so many. And what does that mean? It means that there's thousands and thousands and thousands of people to pull from all these different. They're just very expanse, very big. That's kind of where you'll find your best research. And a well-designed controlled trials. Random control trials are again very good for tests, controlled trial without randomization, single non-experimental studies, systemic reviews, opinions on authors. So yeah, so once you get this information, you're gonna want to look at it. You want to say, is this good information? Do I want to use this enough to intervene, to make an intervention, to make a change? No, you probably don't, unless it's a meta-analysis. So you're gonna have to critically appraise the information. All right. And so the hardest part of this all is we talk about how Professor Sky tells us about how changes happen. People will write the reports in front of the patient instead of at the nurse's desk, nurse area. And that changes, and that people are like, no, guys, you got to write the report in the room. And so people will do it for a short time and then revert to doing it back at their desk in their office. And then people will again make a motion, make a change. Okay, let's do it again in front of the patient, and then they start reverting. So sustaining the knowledge use is equally as important as the initial intervention. All right, so quantitative research. Now we're just talking about different types of research. I'm just gonna skip all those types of research. Okay, so performance improvement does have a. We were talking about this in class, so I'm just gonna go over it as well. Performance improvement is a formal approach of analysis of healthcare-related process at the local level. Local means analysis of processes unique to nursing unit, healthcare agency, or healthcare system. So performance improvement is one approach that organizations learn how to process. Um, all right, so PI would be like instead of intervening and making a new change, in the second paragraph underneath performance improvement, it says PI does not involve the introduction of new practices as in the case of evidence-based practice, but instead involves a review of existing interventions within the process. So just kind of reviewing and improving improving the interventions, not just creating a new intervention. So I think it's a fine line, and I think it's a dumb line to draw. But you can see how these processes are very similar and how they coexist and work together. Okay, so now let's do the review questions, and then we can do our case study, and then we'll be all set. We can check over the slides too. I'll probably do that off the live, but I highly encourage you all to do so. Just because like I think there's less meat and bones on there. And it's not very dense with information. There probably is more information once you download it, and there's more script. But I was kind of unimpressed in class last time or maybe I don't know. You know what I mean? It's still very conceptual. So, anyways, review questions. So match the components to Pico. Okay, so patient and population is going to go, of course, with older adults. Intervention is going to be the using phone tracking app. Comparison is going to be the use of standard exercise log. Outcome is going to be weekly exercise minutes, and time is going to be 6 months. So I didn't really go over that. I just remember these questions because I did them already. Place the steps of EBP process in an appropriate order. Okay. So where is the cultivate the... Okay, so cultivate the spirit of inquiry. And then we're going to ask a clinical question. And then we're going to search for the best relevant. And then we're going to evaluate the... Oh, yeah. Critically appraise the evidence. And then we're going to integrate it. And then we're going to evaluate the outcomes. And then we're going to communicate. Okay, cool. The nurse identifies which of the following outcome measurements. Which of the following as outcomes wait, what? Oh man, I'm tired. All right, let's keep on going. Let's finish it up. Let's do it. All right, so the nurse identifies which of the following as outcome measurements. A nurse teaches the patient how to administer an injection, then watches the patient. I would say, yeah, I would say that's a measurement. Yeah, for sure. 2 as well. What? Okay, let's just do the thing. This thing. Oh, we just did this. Okay, Tracy writes her mock research paper, and in the purpose statement, she includes a hypothesis. Oh, that was a really easy case study. Wow, that was crazy. Okay. We are now done, guys. Thank you all for listening. And if you guys feel like you need any help or any questions with trying to figure out any of the assignments we got, you can always feel free to ask me. So thank you much. Thank you guys so much, and good night. Bye.